Hello everyone, welcome to my channel A to Z Nursing Notes. I'm Rupinder and I'm back with yet another video which is related to working as an RN or RPN without giving your registration exam. So one of my subscriber asked that is it necessary to give the registration exam to work as an RN or RPN. So this video is an answer to that question. So if you are waiting to give your registration exam and you want to work as an RN or RPN, here's what you need to know. So for that you need to understand the nursing registration classes. So all of the nurses there who are working in Canada, they are registered under different classes. So there are 6 nursing registration classes under which a nurse can get herself registered. So if you have in my previous video, that was how to fill the CNO application, I talked about filling the RPN application, and it was in the general category, right? So there are 6 nursing registration classes: the general class, non-practicing class, extended, special assignment, emergency assignment, and temporary class. So let's discuss about all of these classes, and then I will tell you with how you can work without giving the registration exam as an RN or RPN. So first is the general class, and this is the most common class under which all the registered nurses or registered practical nurses, they are registered. And most of the nursing people or the nursing students, they are familiar with this class only. So this to register under this class, you must show that you have an experience working as a nurse in the past 3 years, which can be shown by means of evidence of practice. And the conditions for becoming registered in this class is that you must be registered in the jurisdiction in which you are practicing, and there is no minimum hours required for this, and the RNs and RPNs belong to this class. Next is the non-practicing class. The nurse members who are not working but want to keep their membership at times when they are not working in Ontario, they get themselves transferred to non-practicing class. So suppose there is someone who wants to shift temporarily to another province, so she gets the license of the other province, then they can, but she knows that she has to come back and to Ontario, so she can keep her membership with Ontario province by getting her license transferred to the non-practicing class. So for every registration class you have to pay some amount of annual registration fee, and so in this case, as this is also beneficial because you have to pay a reduced amount of annual fee. This is another benefit of this thing, and you do not need to take part in the QA program. QA is the quality assurance program, and it is somehow related to you have to enhance yourself as a registered nurse or registered practical nurse, and most of the nurses registered with the province, they are supposed to take part in these programs. Certificates of registration, it expires automatically when someone enters in this class. So whatever certifications you have as a registration as a registered nurse or registered practical nurse, it expires as you get yourself transferred to non-practicing class. You can return back to your previous class of registration by fulfilling all the requirements. So whatever requirements you can see in your registration, the application, right? The evidence of practice and language requirements, and your registration exam, all these you have to fulfill. All these requirements, they should be fulfilled if you want to return back to your original registration class. Next is the extended class. By extended class, this is only for those who are getting themselves registered as nurse practitioners. So it is RNs who have additional education and clinical experience, they get themselves registered under this class. So practice by this license, or by this getting yourself registered under this class, you are practicing as a nurse practitioner in these following specialties, that is adult, pediatric, or primary healthcare. Then there is another class, that is the special assignment class. This is a time limited registration with an approved facility in Ontario. So the CNO can give you a limited time registration that you can get yourself registered with this facility. Like they will provide you within a specific facility and in which you can work, and whenever you are working, you have to identify, you have to tell to the person or anyone in the institute that you are an RN or RPN under the special assignment class, and you have to work within the scope of your appointment, and it is defined within the terms and conditions of the approved facility. So you cannot go beyond your scope. Another thing is, you should not be previously registered with the CNO as RN or RPN. So I don't have much idea about it, but I guess in COVID cases, maybe they are travel nurses, so you can travel to the other province also. I guess these are those nurses, they come under the special assignment class. Then the membership, it expires 1 year after the date of joining or the date specified on your registration certificate or the last date of your appointment, whichever comes first. So if your date of joining was 1st January 2021, so your membership would expire on 1st January 2022. Or it can be there is something mentioned on your registration certificate that your license expires on this date, or it can be like your appointment was on the last day of your appointment is 10th of January. So but your registration 1 year completes 1 year of your registration gets completed on 1st January 2022. So your license will be expiring on 1st January 2022, not on the last day of your appointment. Then the nurses who work under the special assignment class, they are either monitored or supervised or directed by a nurse who is registered in the general or in the extended class. They cannot perform controlled acts, and moreover they cannot delegate to anyone the authority to perform the controlled acts. So there are some terms and conditions with this special assignment class. Emergency assignment class. This is when the province declares an emergency and asks the CNO to register qualified nurses in the emergency assignment class, and there is no fee for getting registered in this class. To best explain the situation of emergency assignment class, so taking into consideration the COVID-19 scenario, so there was a time when there was a shortage of nurses, and the government wanted to meet the shortage by calling back the retired nurses back to work. So those nurses, they government may tell CNO to get these nurses registered under the emergency assignment class. So these nurses, they do not have to meet all the registration requirements, all the conditions of the getting registered, completing the RN RPN program, practicing as an RN or RPN as appropriate within the last 3 years before the date the applicant meets the other registration requirements, language proficiency, or any of these registration requirements they do not need to fulfill. And they work under the titles as RN or RPN specified as emergency assignment. The emergency assignment class is authorized for the sole purpose of allowing nurses to assist during the declared emergency. Until the period the emergency is declared, they are supposed to work during that period only. However, assisting does not mean only providing care that is directly related to the pandemic. Nurses can assist in responding to the pandemic in a variety of ways. For example, some nurses registered in the emergency assignment class may cover positions vacated by regular nurses who have been redeployed to deal with the emergency. So maybe that the government pulls out the nurses from the clinics, all the RNs and RPNs from the clinics, and these emergency assignment nurses, they may be placed in their place in the clinics. Instead, the nurses who are skilled in doing the other things, they can get back to the hospital and manage the emergencies. Now coming to the main reason why this video has been made, it is the temporary class. So this is an option for the RNs and RPNs who have met all the requirements for the general class except for the registration exam and have employer offer. So in this case, you can work as a registered nurse or registered practical nurse even if you have not cleared your, or even if you have not given your registration exam. So these temporary class nurses, they can work while waiting for like giving their exam, registration exam, or while they are like they have given their exam but waiting for their result, and they can join once their result has come and they have cleared the registration exam, they can move themselves into the general class. But there are some conditions to this registration class. The membership for the temporary class, it is just for 6 months. It's valid for 6 months and it expires if someone fails the registration exam or fails to get herself or himself registered under the general class within these 6 months of membership. So you have to take care that you register for your registration exam, give your registration exam, clear it or pass it, and get yourself or get your membership transferred to the general class within these 6 months. So you just have a time frame of 6 months to practice as a RN or RPN under the temporary class. So how to apply under the temporary class? So the application for temporary class, it is online only. You can apply online. You have to first register yourself under the general class, then you have to register yourself under the temporary class in a separate application. So you will be having 2 separate applications running separate parallel. Then you have to download the temporary class offer of employment form, fill the section 1, and the section 2 of that form, it will be filled by the prospective employer, and you have to upload that form on the CNO website. If you have already submitted your application, you can submit these documents by sending them by mail to CNO. And then you have to apply and submit your police record check. This is very important because in this case, while you are registered while you are trying to register the general class, you the CNO tells you, or you get yourself your police clearance check, you have to apply later on. But in this case, you have to do this police clearance check as soon as possible, because otherwise it will delay your application. It will your 6 months time it will take until and unless your police clearance is done, you will not be able to work as a RN or RPN under the temporary class. So it will cut short your time frame of 6 months. So it's good to apply for the police clearance as soon as possible. Now, things to keep in mind while you are trying to register yourself under the temporary classes, that temporary class membership, it is valid only for 6 months from the date of issue. So whenever you get your license issued, from that day your 6 months time period starts. And if your temporary class membership it expires, then you have to proceed with your general class application only. You cannot work as a temporary class nurse after that. If you fail your registration exam, in that case your employer, he will get notified that you cannot practice anymore. Also, you have to get your police clearance check done yourself in order to avoid any delays to your police application. So for your general knowledge, the police clearance, it takes approximately 1 week. So it's better to get the process started as soon as possible. And I hope you found this video useful. Thank you very much.